Neuropathy. That's the topic for today. So if you're watching this, that's because you've been diagnosed with neuropathy, right? So today we're going to talk about a specific topic in regards to acupuncture. So let me lay the framework. First of all, my name is Jimmy Yen. If you didn't already know, I'm the Acu Sensei. I'm the #1 neurology acupuncture specialist in the US. And so neurology, neuropathy, you were diagnosed with neuropathy. So this is you've already went to the neurologist. They've already diagnosed you with neuropathy. There's different types of neuropathy. We're not going to get into that today, but you've been diagnosed with one form of neuropathy, right? And from the Western medicine perspective, there's nothing they can do to restore it, to restore your nerve function, right? To reverse neuropathy. So you don't either you've already done the medications, you've already done the injections, but none of them worked, or they worked only short term. They're not really solving, they're not really reversing your neuropathy. So what do you do then? Right? Then you start Googling, right? And when you Google, you probably found out, you probably saw, oh, acupuncture. Oh, yeah, acupuncture could help with neuropathy, right? So now here you are, you've like, I want to try acupuncture, but there's, different acupuncturists. Let's say, for example, you're in Austin, Texas, where my clinic is located, and you're like, oh, there's so many acupuncturists. What do I choose? I mean, how do I know if they know what they're doing, right? So we're going to tackle part of that question today. So what the question is, what do you do when you go to an acupuncturist? Like, how do you know that they're going to be effective? How do you know they're going to be able to help you reverse your neuropathy? What are all the techniques and therapies that are used across different acupuncture clinics, and which ones actually are the best? Where should they put the needles or the little pins? Where should they not put the little pins? Right? Those are probably some of the questions maybe you didn't even think about. I'm going to address them today, and I'm going to go through so that you have more information. Okay. So to start off, there are tons, hundreds, if not thousands, of different types of acupuncture technique. Okay, so I can see it is very hard for the public to choose, to know what to choose, like which acupuncturist to go to, which technique is actually the best, and which one doesn't work, and so forth, right? Um, so I'm gonna give you a little insight, right? So what we practice at Achieve Integrative Health is called restorative acupuncture neurology. Just like the name says, we are the only clinic that does restorative acupuncture neurology. Um, and so what does that mean? That means our acupuncture technique actually helps restore your function, restores your organ function, restores your nerve growth. And we're not just here to put a little band-aid on it and help with your symptoms. We actually can help you restore function with our specific acupuncture technique. It's actually called quick restorative acupuncture, QRA, right? So we are the only clinic in the US that does this because that technique was developed by me, right? No other clinic does this. So coming back to restorative acupuncture neurology, what you're probably wondering, what do you watch out for, right? Well, before we do that, you're probably wondering also this: why should I listen to you, Jimmy, the Acu Sensei? Why should I listen to you, right? What makes you different, right? So let me give you a little background, very brief background. So I am a licensed acupuncturist, and I've built our clinic is the largest acupuncture clinic in Austin, Texas. I am the only acupuncturist that is on the medical advisory committee for a neuropathy nonprofit organization. I sit on that committee alongside all of the top neurologists in my city. I am the only acupuncturist. And the only reason why I got into that committee was because of the results that my clinic produces. So results are the bottom line: results, 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 right? And I'm pretty sure that's what you're looking for, right? And so you can also look at Google us. We actually have the most five-star Google reviews, okay, in the entire US, right? So we're the #1 acupuncture clinic in the entire US, and that was recognized by the public, not by me saying that, right? So those are some of the reasons that why you might want to listen to what I'm talking about, okay? So let's go to you. Let's get away from about me and my clinic. Let's go to you, right? Focus on, what is the focus? So big difference is the focus of each acupuncture clinic, right? So not every clinic focuses on the same things. And for example, most clinics, I would say 90% of the acupuncture clinics in the US, their focus, okay, let me write this down. Their focus is on symptom relief. And we focus on that too, okay? So symptom relief, what is that? That's relief of your pain. That's relief of your burning, okay? What about your tingling, right? Your tingling and numbness, okay? Shocks. That is symptom relief when these symptoms start to decrease, okay? So majority, I would say over 90% of acupuncture clinics focus on symptom relief, which is important to you, right? Because it's bothering you, right? And so very few focus on corrective care. So corrective care is actually you're correcting the problem. Like what caused these symptoms to begin with? What caused the nerve damage? Because that's what neuropathy is. Neuropathy is nerve damage. What caused that nerve damage to begin with, right? And so whatever that cause to your nerve damage, they repair nerve damage. Okay, so that is called corrective care. You correct, guess what? You correct the cause, right? So whatever causes the nerve damage, some clinics correct the cause, right? So why do you want to correct the cause? Because if you don't correct the cause, guess what? These symptoms, these symptoms up here, they're going to keep coming back. So you may go to a clinic that does acupuncture and they relieve your pain, relieve your burning, your tingling, numbness. They're very minimal or they're gone, right? And then they discharge you. That's a relief care clinic, right? So when they discharge you, they still haven't fixed the problem, right? So if let's just say your symptoms are down, your symptoms are very minimal or they go away, okay, and then they discharge you. They go, okay, you're done, you're fixed, go away, right? And so, but your symptoms are going to come back because they didn't fix the root cause, right? So this is why this is really step two. Corrective care is super important. Corrective care corrects a problem so these symptoms don't come back. Okay. So there's another step. All right. That's what we call restorative care. Right. So this is really, if you think about this is really step one, corrective care step two, right? Restorative care is step three. So what is restorative care? So restorative care is to restore your body's ability to heal itself again. So even when you fix the root cause, like you fix the cause, okay? Sorry, you fix the cause that caused these symptoms, right? But you didn't retrain the body to heal itself again. So eventually, even though you correct the root cause, eventually that whatever root cause can come back. And guess what? That will eventually have the symptoms come back as well. So the real solution, if you don't want it to come back, is you have to retrain your brain to heal your body again. Okay, that's restorative care. Restorative care, the end result is your body heals itself again, heals itself by itself without acupuncture. Now that's not possible for everybody because some of y'all who have neuropathy, you got it because you had cancer, you had chemotherapy, you had radiation, and that killed not just your nerves, but it killed some of your cells and it really caused a lot of malfunction, dysfunction in your organs, right? So we may not be able to restore all of your organ function. But not to get too deep, I want to stay on, what's the difference that you're going to find in different acupuncture clinics. You're going to find, let me just summarize it again. You're going to find clinics that only focus on step one, which is relief. Let me write it better so you can actually read it, right? So you're going to find clinics that only focus on relief. Your symptoms are gone, they discharge you. Then you're going to find even fewer clinics that focus on corrective care. Okay. They correct the cause that caused the symptoms. And then you're going to find our clinic. This is why people travel to Austin, Texas to get treatments from our clinic, because we're the only clinic that does this. Restorative care. Restorative care is what restores your body's ability to heal itself. Okay. So that's what I mean by, if we come back here, focus, right? Focus. That's the difference that's how you'll differentiate which clinic you want to choose. So relief care, corrective care, restorative care, it depends on you, what you want. I'm not telling you what you should do or what you shouldn't do. I'm just letting you know the difference. Okay. So focus. Then what are the common therapies used in acupuncture clinics, and are they beneficial, right? So everybody's going to do acupuncture, right? Okay. So again, acupuncture, there's these three different ones. Most acupuncture technique provide relief, fewer provide corrective care, and only one, QRA, provides restorative care. Okay. So acupuncture is, you also have some clinics that do E-stem. But let me come back to acupuncture, right? I'm going to separate where they're going to place the needles. So let me just erase this for a second so we can stay focused on acupuncture, okay? So they can put needles, the little pins, locally, which means if you have neuropathy, mainly, in your feet or your hands, they put the needles in your hands and feet, right? That is called locally, right? Distally means they do not put the needles in at the site of your neuropathy, at the site of your nerve damage. Like if you have neuropathy in your hands and feet, they don't put needles in your hands and feet. They put it away from your hands and feet. That is what's called distal. Okay. So what's the pros and cons, right? Local. So local, again, they put the needles at the side of the problem, right? What happens when you do that? Well, there's a 50% chance they will make your neuropathy symptoms worse. That's the risk of doing local treatments. Okay, 50% chance of your symptoms getting worse, right? And potentially making your neuropathy worse. But there's also 50% chance they'll make it better. Okay, so I'm not trying to tell you what's good or bad. I'm just letting you know the data, the proof, the statistics. Okay, distally, 0% chance of making your symptoms worse. Okay. Now, how do I know that? Okay. Because when I first started my practice in 2007, I did it locally. I didn't create the QRA at that time. I did it locally. I utilized what I was taught in Chinese medical school, which everybody uses. Everybody was taught the same thing. So I did it locally, and I found out that I was making some patients' neuropathy worse, right? So that's how I know. It's through experience. It's through treating tons of people. And also going back to, why you should listen to me and my team. We treat more people, more patients than most clinics. So we treat about 30 to 40 patients a day in our clinic. We have a big team. So We've treated thousands of patients. We have, when I say experience, I'm not talking about years of experience. Because think about it. What's more important to you? A provider, a doctor who has 20 years experience, or a doctor who has, let's say, a doctor who has 20, let me write this down. What's more important to you? A doctor who has 20 years of experience, they've been practicing for 20 years, they've treated 1 million people. I'm just making these numbers up, right? Versus someone, a doctor has only been in practice, only has 10 years of experience, right? But they've treated 10 million people. Oops, I'm spelling million wrong, but you get my idea, right? Which doctor would you want? What type of experience is more important to you, right? I think it's safe to assume that most people want the doctor who's treated more patients. That's our clinic, right? So our clinic treats 30 to 40 patients per day. Okay, that's per day. Most acupuncture clinics treat 30 to 40 patients per week. So you can see the big difference, right? We've treated more patients. We have more patient experience, right? So just wanted to give you that insight, not to get off track. So that's how I know local treatments don't work for neuropathy, or they work with a 50% success rate, right? So distally is, in my opinion, the best way to go. So that's one thing that you can ask the acupuncturist who you're looking at to treat your neuropathy. Do they do local treatments or they do distal treatments, right? Okay. So next is E-stem. That's electric. So it's electric acupuncture. Some people call it electroacupuncture. Electroacupuncture. Okay. Basically, they put the little pins in you and then they attach these little alligator clips and it sends electricity through it, right? Now, there are different types of electricity. There's TENS, something called TENS units, and then there's microcurrents. Okay. So what's the difference? TENS units are like, when you go to physical therapy and they put these little pads, right? That is a TENS unit. So if you imagine, let me draw a graph. So our bodies, our cells, our nerves communicate with each other, right? Let's say that they communicate at this wavelength. Well, a TENS unit communicates at this wavelength. And the purpose of the TENS unit is to suppress the message in your nerves, right? That's why TENS units are, very good for pain, because if you imagine this is pain, yeah, your cells are communicating. You're like, oh, I'm in pain. I'm in pain. I got back pain, right? And then the TENS unit comes in and pushes that pain signal, message down. So it drops it down to here. So you feel less pain. So that's what a TENS unit does, right? So that's why it's not effective for neuropathy. So if you go to an acupuncture clinic and they connect like a TENS unit to your needles, it's not really helping you. All right. It can help you with your burning, maybe, and your pain, but it's going to do nothing for your tingling and your numbness. It definitely won't help your numbness. Okay. And it won't help restore your nerve, regenerate your nerve. Now, a microcurrent, that's a little different. So a microcurrent doesn't communicate at a TENS, right? A microcurrent could communicate at the same wavelength, as your nerves. So let's say a normal nerve communicates at this wavelength. You can say a wavelength, like if I talk really loud like this is a high wavelength, right? Or if I talk normal, that's a normal wavelength. Or if I talk like this, and this is a soft wavelength, right? So you can think of wavelengths like that, like the intensity of it, right? So let's say normal is like what I'm talking to you right now. So this is a normal communication. right? So this is normal, all right? And a microcurrent, it can, oh, I just erased it, everything, sorry. It can communicate at the same wavelength, okay? So if someone uses a electro acupuncture, you want them to use a microcurrent, right? The microcurrent you typically won't feel. The TENS unit you will feel, like prickling, stinging, and your muscles will pulsate, right, or contract, right? So you want to find someone that that uses a microcurrent. Now, there's difference in microcurrent. We use something in our clinic called nerve reboot therapy. Nerve reboot therapy. Because there's different microcurrent devices. Oh, yes. Why does it have to be so complicated? Yeah, I know. All right, so this is your normal way of communication. Your body communicates like this. I'm just giving you as an example, okay? Now, the difference in the microcurrents, so the microcurrent device that the acupuncture clinic uses, they may communicate in the same wavelength, same wavelength as in the same level, okay? They may communicate like this in the same level. But look at that. It's like opposite message, right? It doesn't match your communication. So it's like, let me give you an example. It's like I'm speaking English right now, but what if I spoke to you in Chinese, right? For those of you who don't speak Mandarin, right? And I spoke to you in Chinese, you're not going to understand. So if you don't understand, then you're not going to receive the message, right? So that's typically what most people use. What most acupuncture clinics use, they use a microcurrent that speaks a different language, right? And so that's why we, in our clinic, we found a device. Oh, crap. Let me move this back. We found a device that can actually speak your nerves' same language. How cool is that? And we call that nerve reboot therapy. Can you see why my clinic gets better results? Because all of these things matters, okay? So that's electro acupuncture, right? What else do most acupuncture clinics use in regards to treat neuropathy, right? So they will also use herbs. Again, now the herbs can be focused on symptom relief. They can focus on corrective care, and they can be focused on restorative care. Now, when you ask a clinic, do they do restorative care? They won't know what that is because most clinics don't do it, right? Actually, it's something that I developed. So they won't know. So you need to ask them, so, hey, if I take these herbs and I stop them, is my neuropathy going to come back? That's a question you can ask, right? So herbs can help you with your symptoms, and then you stop taking the herbs and everything comes back. That's called symptom relief. Herbs can correct the problem. So whatever problem was causing, okay, assuming it's not outside problems, right? Like chemotherapy, radiation, you can't correct those, right? Or if you have a your spine was actually pressing on a nerve, you have some structural damage in your spine. Only surgery can correct that, and that's not even 100%, right? So corrective care is, hey, the symptoms are gone, and then you stop taking the herbs and they stay gone, but then a few months later, they start to creep back up again. They start to happen again, okay? That's corrective care. Restorative care is the symptoms don't come back, period. Now, again, not everybody can have restorative care done 100% because of the damage that you did to your body, or medication did to your body, or chemo did to your body that cannot be reversed, right? So there's all, it's all relative. But the key is the tools that every acupuncture clinic uses are pretty much the same. Similar, I would say, not the same, similar. The difference is in these details, in the minutia, right? So acupuncture, do they do it locally, distally, right? So if you think if it makes it worse, it's probably because they did local. Electric stem, did they do TENS unit? Did they do microcurrent? Did they do nerve reboot, right? That's difference. Herbs, did they give you herbs to just help with the symptoms, or did they actually correct the problem, or they restore their body's ability to heal itself, right? And how do they determine that? If they correct the problem, how do they determine? That's a question. How do you determine what was the cause? So I'm gonna give you some insight. Besides the chemotherapy external, there's external reasons, right? We can't change those. I'm talking about internal reasons. That's what herbs address. So from the internal reasons, it is always organ function. I just gave you a little secret, right? It's always organ function because your organs are what heals your body, or responsible for restoring your body's health, right? So the next question is, how do they determine organ dysfunction? Like in our clinic, we have, again, a diagnostic tool that I created. Only my clinic does this in the whole US. Functional pulse diagnosis. That is how we identify which organs are dysfunctioning, okay? Not just the ones that are causing your neuropathy, but the ones that are preventing your body from healing itself, healing the neuropathy by itself. That's why we can do restorative care, okay? We also have a metabolic breath analysis. Analysis, spelled it wrong. We also have medical thermography. We also use a 3D body scan. Okay, so we use functional pulse diagnosis, which is based on traditional Chinese medicine, which is a 3,000-year-old medicine. Okay, this functional pulse diagnosis is something that I created. Okay, only our clinic and my team does this. And so we use 3,000-year-old technology with today's technology. So metabolic breath analysis, medical thermography, and 3D body scan, these are today's technology. And we combine both of them. Also with your blood labs, blood chemistry. That is how Achieve Integrative Health, my clinic, that's how we determine which organs are dysfunctioning. So you can see how comprehensive that is. And that's why, again, that's why we have the most 5-star Google reviews than any clinic in the entire US. Okay, so these are the general, I would say that the general things to look for when you are selecting an acupuncture clinic to see, to get help for your neuropathy. Okay. Now, in future videos, I will tackle other questions like chiropractic. Chiropractors are saying they treat neuropathy. How do they treat it, right? So I'm going to tackle that in future posts. So stay tuned.